Hello, my name is Shriti Mehta and I'm a board-certified interventional and general cardiologist practicing with St. Cloud Medical Group. I would like to talk to you briefly about what a cardiologist does and when do you need to see a cardiologist. So in terms of what a cardiologist does, we perform thorough history and physical, which allows us to determine the nature of your symptoms, any cardiovascular risk factors you have, and any objective signs of heart disease on the exam. If needed, we can perform tests such as blood work to see if you've had signs of a heart attack or any risk factors like high cholesterol or diabetes. We can also perform an EKG or electrocardiogram, which allows us to determine the heart rhythm and any signs of a heart attack as well. An ultrasound of the heart or echocardiogram allows us to look for evidence of heart failure or any problems in the valves of the heart. Vascular ultrasounds allow us to look at the arteries in various parts of the body, such as the legs or in the carotid artery supplying the brain. We can look at the veins as well. An event monitor allows us to look at the heart rhythm over time. And finally, a stress test allows us to determine what is your risk of having a heart attack in the future. In terms of procedures we perform, this includes a cardioversion that converts abnormal rhythm into a normal rhythm, especially in unstable patients. In patients who've had a heart attack, we can perform a catheterization, which allows us to see is there any blockage in those arteries supplying the heart. We can also do this if you have abnormal stress tests. If needed, we can intervene by putting a balloon and stent. We can do peripheral angiograms, which allows us to see if there's any blockage in those arteries supplying the legs and intervene on that if needed as well. So in terms of when do you need to see a cardiologist, this includes symptoms of chest pain, trouble breathing, feel like your heart is racing, dizzy, having fainted, or even swelling in the legs. Certain signs that patients are referred for, including having a heart murmur, an abnormal electrocardiogram, which is often used for screening, or even preoperative clearance before surgery. Conditions we treat include coronary artery disease, such as patients who already have stents or bypass surgery, those patients who are having a heart attack or heart failure, abnormal heart rhythms, and even underlying risk factors for heart disease like high blood pressure and high cholesterol. Our goal is to provide counseling to prevent heart disease and evaluate your risk for heart disease. For those who have heart disease, we want to help you live longer lives and improve your quality of life. I would be happy to help you for any of the conditions we discussed. We are accepting new patients in my clinic in St. Cloud, so please give us a call and we'll be happy to take care of you.